Welcome to Coping with COVID-19, an editorially independent program from the editors of Modern Aesthetics Magazine and Practical Dermatology Magazine. Reports of adverse events among patients treated with dermal fillers have been reported post-COVID-19 vaccines. In this episode, aesthetic physicians discuss cases they've seen and their approaches to treating these complications. Panelists include Drs. Michael Gold, Doris Day, Mark Nestor, Joel Schlesinger, and Amy Taub.
Hey, I wonder if I can ask one question to
Sure.
people. We are seeing quite a bit of unusual reactions to fillers, and I've had more challenges in the last 3 months with people that have had swelling, especially under the eyes. Oh my God, it's like driving me nuts. People who had fillers way before the pandemic and have come back with repeated bouts of swelling. Tried the lisinopril, not much of an improvement. Tried prednisone, modest improvement while they're on it, but bumps right back after they're off of it. So it's really becoming quite a bit. We've dissolved more filler in the last month than we've ever in my entire practice up until now. So I just wonder if others are seeing this or if I'm just alone.
So that is it one or two fillers in particular, or does it matter which one?
It's across the board.
All right.
So I use Doris, only HA fillers. I use some that are the Juvederm family, some, mostly Juvederm and Restylane family. So it's not one or the other.
Doris, you seeing any of that?
Knock on wood, I haven't seen it yet. I haven't seen it. I have noticed that my days are filled with fillers these days, that people are back and they're just trying to catch up with what they've lost. The only filler I use under the eyes is Restylane, and I only use a cannula to deliver it, and I don't usually put in a lot at a time. I'm sure we all have similar technique. But I also am, it's not recent filler I'm sure you're talking about either, Joel, but I do space out fillers around vaccine. So if someone's getting the vaccine, I wait for 2 to 3 weeks after, and I don't have them get the filler for at least 2 weeks before. I don't know that it really matters that much before, but I just have them wait around a vaccine, which gets really challenging around the flu season. But I've done that for years and around dental work, but I haven't seen it. I'm hoping that stays true, so I keep knocking on wood.
There you go. Amy, anything on your side?
I've seen 2 or 3 cases lately. I have this one woman who I did not put the filler in, but she had filler elsewhere and she had too much. She had 9 syringes.
Oh, wow.
And then it kind of, yeah, I know. Like, who puts in 9 syringes at once?
Around her eyes, you mean? Or just in general?
Her whole face.
Oh, okay.
So, and then she blew up, and she had the vaccine 3 to 4 months ago. I really do think it was from the vaccine because she had that kind of diffuse swelling. It was hot and it hurts. Unfortunately, I did lisinopril, and it seemed to help. I also put her on clarithromycin because in the beginning I wasn't sure what was going on. So I put her on that for 2 weeks. And while she was deciding whether or not she wanted to have it removed, then she went off of it. And the next day her face swelled up again. So I was a little, wondering what was going on. So I put her back on it. But unfortunately, this lady is very tearful and frightened. And even though I keep saying, let's just take it all out, she's only wants me to do a little bit at a time. And each time we do it, it's much better in the area that we did it. So I guess she wants to come back every week and for a while.
Yeah. Are you finding that I've had one case and I've done more hyaluronidase in her than I've normally done. I'm pretty sure I'm getting ready to buy one of those ultrasound things and learn how to use it. Because I'm tired of using up all my hyaluronidase from this. I think it's called the Clarius.
Yeah, we have it. It's actually very good.
Does it
You
help?
like it?
Yeah. Yeah, it's for dermatology, it's $6,500. It hooks up to an iPad or your computer, etc. You've got Doppler associated with it, so you can actually see blood flow and blood vessels. You can do I use it for SRT to measure the skin cancer depths, which is actually reimbursable. And you can use it to do all sorts of things from that perspective.
I guess you could also map out their anatomy.
Yes, you can.
Like, especially if they had surgery or something like that, that would be cool. But from what I've heard, mainly from colleagues on the internet, it seems like you can pinpoint the area really well. And so you don't need to use as much hyaluronidase because you can really get, rather than like flooding an area. I mean, you can usually feel it, but then that doesn't mean that you're getting right in it. So I think I'd like to try that. I had another lady.
And also, if you massage the area pretty heavily after, if you really rub hard, you can get it to spread around nicely.
Yeah, I had another lady who had also a ton of filler somewhere else and a bunch of threads on top of that, like tons of threads. And she is the worst case I've ever seen. I mean, it took me, she was willing to get it done, anything. It took me weeks upon weeks, and she's still suffering a little bit, but I used my Ultherapy ultrasound and I could actually see threads with it. I saw the threads.
Were they the barbed threads or the smooth and twisted?
They were smooth. They were smooth. But anyway, that's been, I mean, with her, I think I used like 8 vials of, I've used so much Hylenex for her. And, I'm just thinking if this is going to start being like more of a thing, I don't even know that it's from the vaccine. I think just there's so many really bad injectors. I mean, people who just don't, they just don't care. They just want to make money, and they just put more and more stuff in. And then you get these dreadful outcomes where these women are just, I was texting with her for weeks. I felt so bad for her. She was actually a very nice person, and she was completely freaking out. It was before her daughter's wedding. And I mean, I felt really bad for her. So she's still dealing with some of the aftermath. She's got hyperpigmentation now from all the inflammation. And I mean, it looks like just her face was all stretched out. She's got new folds. It's really, really a nightmare case. Fortunately, it wasn't mine, but I feel for these people. And now we're partly on the vanguard of like helping to fix, other people's mistakes. And, some of these doctors on the internet, like, say you should never touch anybody because you'll be in that malpractice lawsuit. That is a horrible attitude. I think, we're in the business of helping people.
Right.
So I wouldn't turn anybody away unless, obviously, if they were like, a lot of red flags, then you might not want to get involved. But, a lot of these people are just helpless and they don't know any better. It's really sad.
Problem. This group is all a group of fixers, so that's something we've all gotten used to doing anyway.